How does breastfeeding impact fertility? And can you do fertility treatments while you are still breastfeeding? I'm Dr. Jessica Reineck, a double board certified OBGYN and reproductive endocrinology and infertility specialist. This is a question that I get asked variations of all the time. And so today I'm going to talk about the impacts of breastfeeding on fertility and fertility treatments. So first of all, people can get pregnant while breastfeeding. And so if goal is not pregnancy, it's definitely important to be using some kind of backup contraception in that time period, even if you're not getting a regular period. However, breastfeeding can also significantly impact your fertility in a number of different ways. So this is not the gland that you're thinking of, but it is a gland that is particularly important when it comes to reproduction. And that's the pituitary gland, which is found in the brain. And you can see here, it makes lots of different hormones, but I want to call your attention specifically to 3 different hormones. First, the FSH and the LH, those are the gonadotropin hormones that are the main way of communicating from the brain to the ovaries. And then second, the prolactin, and that is the hormone that stimulates milk production. And you can see that these hormones come from the same place in the brain. And this is a problem because when the pituitary is busy making prolactin to stimulate breastfeeding, it's not going to be working as hard to be making FSH and LH to stimulate the ovaries to ovulate and function normally from a fertility perspective. And we see this not only with breastfeeding, but also when prolactin is elevated in other situations, like if there's a lesion in the brain that's making more prolactin, or if you're on medications that stimulate prolactin production. And the impacts of elevated prolactin on fertility are pretty well documented, that at certain prolactin levels, initially you'll have a shortening of the luteal phase, which is when implantation occurs. Then you'll actually have a lengthening of your cycles because you ovulate later, and then eventually you will stop getting your periods altogether. When you're breastfeeding, typically it goes in the reverse, where as you start to wean, you're not getting your period, you start having irregular cycles, and then you might start having regular short cycles. And then once you stop breastfeeding, or once the suppression from the elevated prolactin decreases enough, you would start going back to your regular normal length cycles. Another potential impact that prolactin may have on fertility is that it can thin the uterine lining, which can lead to lower implantation, miscarriage, and later complications related to the placenta. So even if you can get pregnant while breastfeeding, there may be a number of factors that impair fertility or potential pregnancy outcomes. And that's when it comes to fertility treatment, we're often cautious, and many of us will recommend stopping breastfeeding before trying to get pregnant again. As a fertility doctor, there are 3 main considerations that I have when talking to someone about breastfeeding and pursuing fertility treatment. And number 1 is how the medications and also pregnancy may impact their breastfeeding relationship. Some of the medications that we use and also pregnancy itself can decrease milk production. And I'm assuming if you want to keep breastfeeding during fertility treatment, you're not ready to be done breastfeeding. And I never want to end that relationship before you are ready. Number 2, the meds you are taking may pass through the breast milk to the baby. And number 3 is how breastfeeding might impact the success of the fertility treatments. And there's not as much evidence here, but there's lots of evidence to support how elevated prolactin caused by breastfeeding can impact your fertility in general, and we can apply that to fertility treatment success.